Hey guys, I'm back with another update video for my orbital decompression surgery. I know it's been a long time. I am actually like 5 weeks post-op. Yeah, so it's been over a month, and yeah, I'm feeling pretty good on my eye. I still feel like some numbness right here, very slight, but like when I touch it, it feels weird and um, just right here on my temple, really. As you can see, like my eyes still aren't like matchy, but it's mainly because of like my eyelid is still retracted, so I really think I'm gonna need the eyelid surgery, but I don't see my doctor for like another 10 days, so we'll see what she has to say about that. But I have makeup on, but my scar looks pretty good. It's like right where it's at. It's kind of like a bump, on the inside. So as you can see, I have more flatness right here, and over here it's like I don't. So I think that's just combination of the scar with my eyelid being retracted. Like if my eyelid came down a little bit more, look more symmetrical. But I'm actually pretty happy with it. I'm not, as long as my eye wasn't popping out, I'm happy. And if I need the eyelid surgery, then I'm gonna go ahead and do it. Um, Also, I've been experiencing, I've just been waking up a lot with my eyes just being like really gooey and like just all this gunk like on them and like coming out. I don't know. It's just like I don't know if it's due to like dryness or what. I mean, my eyes don't feel dry, but I don't know. I know I had that symptom from before I had the surgery, but I don't know. I mean, I'll tell that to my doctor. And the other symptom I've been having is like my right eye now. I've been getting, excuse me, sorry. I've been getting like just it's just like for a moment like the like sharp pains right above my eye, and I'm like, great, just if this eye starts protruding or whatever, it's like but yeah, so I've kind of been getting that, but it's only like very, like, it hasn't happened for a while, and when it happens it's only for like a moment, and then I'm fine. But I don't know. So and that's pretty much it. I mean, like I have like a little I have makeup on, but I have a little like scar from the my other video. I had like a little abrasion right there. Just a scar there. It doesn't bother me. It's like whatever. um but yeah, so this is it, like 5 weeks post-op, and I'm doing good. I finished school. I was only gone from school for a week, and then I was able to, drive myself after that, and, be in class and be totally fine. Uh, so yeah, I mean, I feel a whole lot better, no more pains, and, no more dryness. And I remember I used to feel like, just my eye would be more exposed. Like you could feel that, and I could feel like the air hitting my eye, and so now I don't feel that. Um, I don't really feel like my eye is open. I do feel like a little bit of a difference, but I think it's just because I'm still healing, and there's like scar tissue and it's numb right here. But, like I'm only 5 weeks. Like if you think about it, that's really not a long time, and it takes usually like a whole year, to really like fully heal from a surgery. So I'm happy with it so far, and yeah, I'll do another. Well, actually, before I say that, I was asked about because when I was doing my videos, I left out like the risks of orbital decompression surgery, and I was, wanted to mention that. So the risks are mainly is you can get double vision. That's why when right after surgery, like as soon as I woke up, they held this little card in front of me, and they asked me to read the smallest letters that I could. And Drexel, puppy, hi, say hi, hi, say hi to my friends. Oh, you're so cute. So where was I? Yeah, you can get double vision, and they check that immediately once you wake up, and that's the main risk. But the way I see it is with thyroid eye disease, you already have a risk of getting double vision. It's probably a lot more higher. So it's just kind of like, you know, can happen either way. And with surgery, especially if you have a very good surgeon, your risks of that are lower. So that really didn't scare me, because I was like, well, if I don't have the surgery, then it can happen. I mean, it most likely will happen, and so, it's just like, I don't know. That really didn't like scare me. I mean, it's just whatever. I don't know what I'm saying. Anyways, and the second one, of course, is infection. I was taking Humira, before surgery. She just gave me lots of antibiotics. I didn't get an infection. It was totally fine. And then the other main risk is obviously going blind. They can damage like your optic nerve or your cornea, and you can go blind. But it's just, I mean, that would suck, but I don't know. I mean, you can go blind anyway with thyroid eye disease if it's not, taken care of. And so, I don't know, surgery seems more like at least you have the chance of, making your eye better. So that's the way I look at it. And there's a very, very tiny, it's like a rare complication, which is that, like, if the surgeon is being too aggressive and, like, filing away bone, like, they could, like, puncture, like, go through the skull and, like, have cerebral spinal fluid, like, be leaking. But they say, like, that's, like, super rare, and that's, like, if your surgeon isn't really good, or so that's that. My doctor really didn't tell me about that. I actually read it online, but I had total faith in my doctor. Like, she's awesome. And as long as you have somebody that's specialized in Graves' disease, thyroid eye disease, orbital decompression surgery, I really think you're in good hands, and that your risks, are like that, like your percentage of getting one of those risks is very low. So yeah, I mean, surgery obviously is like the only treatment, and it was scary. Like, when my doctor told me that, like, I cried, and I'm like, that sucks. That surgery is my only option. But it's, all I say is, like, just don't be afraid. It really does make a huge difference, and it really helps. It can be scary, but I think thyroid eye disease can be even like more, like, can be scarier. I don't want to say more scarier, and just like living in pain, and you don't want, especially if you're young, like you don't want to mess up your eyes. And if your eyes aren't able to close, then that'll lead to dryness, and that will damage your corneas. And so you just kind of gotta weigh your options, and just take that risk, take that leap of faith, and like make sure your doctor is a good doctor. And they know what they're doing, and that you talk to their other patients and stuff. And so I mean, even if you have to travel, like, to have surgery, do it. It's, to me, it's super important. And I'm super happy I did it. It really was a pretty easy surgery. I was afraid of the pain afterwards, but I really didn't have any pain. Just like I said, when I would move my eye from left to right, um, that's when I had the pain. And it wasn't like unbearable pain where I'm like, oh my gosh. It was just like, ow, and then I just wouldn't move my eye from left to right. And of course, you can get pampered and, just vegetate for like a week. So that's always a plus. But yeah, it's really not a bad surgery at all. And every surgery has their risks, and you just so do diseases and medication. So it's just kind of like all in the same boat. But yeah, so that's that. If there's sorry, if there's any other questions, just leave it down below in a comment, or you can ask me questions on Instagram at TigerLily with well, it's spelled TYGURLILY. I'll put it in the down bar. Excuse me. But yeah, I mean, I'll do another update around May 26th. I think that's my next my doctor's appointment, and my checkup with my eye doctor. So I should know whether I'll be doing eyelid surgery, but I think I will, because I kind of want it to be down a little bit more. That helps with the dryness and stuff. So, and the way I look, but I'm pretty happy. I can totally tell, like that my eye sits back more, and I'm just, I'm happy with it. I'm really content and just grateful that I was able to have the surgery and have no complications. And yeah, so thank you for watching, and yeah, ask me any questions on Instagram or on here, and yeah, I'll get back to you as fast as I can. But until next time, I'll see you. Bye, guys.